Hello and welcome back to Langford Academy Nursing Stream. My name is Hannah Mackenzie and I will be talking today about stepping into specialisation, a guide to referral nursing. So a little bit more about me. I'm a theatre nurse at Langford Swanhill Hospital. I previously worked in a general practice / certificate-led referral centre as a surgery and anaesthesia nurse. Before this, I worked at an equine referral centre after studying equine veterinary nursing at Hartpury University. So over the next 3 parts, I will be covering embracing the excitement of the role, stepping into the role with openness and enthusiasm, understanding the referral practice environment, its similarities and differences to general practice, sharpening your skill set for referral care, discipline-specific skills that may be required and attributes to hit the ground running, self-care and professional development, feeling comfortable within one skill set and knowing your needs to achieve within the referral environment, alongside adapting to the new working environment, how to adapt and draw on previous experiences to feel confident. So within a referral environment, you will meet a wide range of people who obviously cover a wide range of roles. Within general practice, you might be working in a much smaller team, which might be made up of your receptionists and admin staff, your veterinary surgeons, veterinary nurses, and possibly auxiliary staff such as animal care assistants, patient care assistants. Within a referral environment, there is a much wider range of roles. So currently I've put a few up. So you might be working with interns. These will be veterinary interns as well as veterinary nursing interns who tend to rotate around the hospital to kind of like gain experience before possibly going on to specialise. Residents, so these are veterinary surgeons who have usually completed an internship. This might be rotating, or it might also be a specific specialist internship in an area they're interested in. So residents tend to be part of your team between 3 and 4 years, depending on the place you work at and also the governing body for their specialism. So they tend to work for 3 to 4 years whilst they're training to become specialists. Your specialists may also be known as diplomats, senior clinicians, senior specialists. These are veterinary surgeons who have specialised and have sat their board exams as a resident and gained board certification. You also may encounter veterinary students, veterinary nursing students, depending on the area you work in, also depending on the referral hospital. As well, you'll have RVNs, much like you and me. Advanced RVNs, these are RVNs who have again gained additional qualifications or have additional responsibilities within specific areas. They might have sat their vet tech exams, they might have certificates, it all depends. I've also put senior nurses. Again, these might be head nurses, deputy head nurses, or senior nurses within certain areas. I've added in advanced practitioners. Again, these are veterinary surgeons. They may have a certificate. So some of you may already have experience working with advanced practitioners. Again, they have a specialist interest. They have a specialised interest in a certain area, but they are not diplomats / specialists. But again, very important members of the team. You will encounter receptionists, animal care assistants. There may be more admin staffs, such as marketing staff, HR staff, and possibly maintenance staff who are in charge of the hospital's they may oversee the hospital's day-to-day running. So, understanding the referral practice environment. So, within a general practice, you are usually the first point of contact for pet owners. Within a referral environment, referral veterinarians typically handle cases that have been referred by the general practitioners because of the condition may be too complex or more challenging to diagnose or treat. Within the scope of care of general practice, you would tend to provide routine care for a wide range of animals. So these are obviously your wellness exams, your elective surgeries such as spaying, castrations, dentals as well, vaccinations, your kind of like first point of diagnostic imaging and diagnostic testing. But that does not mean that you will also not be doing more complex within general practice, such as pyometras, orthopedics, such as TPLOs. Within a referral practice, you are much more specialised for more complex, which means you can take on more complex cases. These include specialised diagnostics, such as CT, possibly MRI, more advanced surgeries such as pericardectomies, dependent on where you work, depending on kind of the staff members you also work alongside, oncology, neurology, orthopedics, cardiology, and other areas that may require a much more in-depth knowledge of specific areas. So again, talking about facilities within a general practice, they're often equipped with your basic diagnostic tools such as ultrasound, an X-ray machine. You may also, a lot more practices are tending to have CT machines as well, and also possibly endoscope or gastroscope. You will probably offer more routine surgeries such as spaying, neutering, and dental cleanings. And then within a referral practice, you're usually equipped for more advanced diagnostic equipment, as I previously stated. And these are usually interpreted by a board certified specialist in imaging for that kind of side of things. And then talking about treatment within a general practice, GPs tend to treat a broad spectrum of conditions. They may refer cases that require more advanced diagnostics or specialised treatments to a referral practice. And then the treatment within a referral practice, referral veterinarians may offer advanced treatments, surgeries, or therapies. Then a general practitioner is either not trained or equipped to handle. After treatment, a lot of the pets and patients will return to general practice for ongoing care. Within talking about facilities as well, within a referral hospital, for instance, following orthopedic surgeries or maybe following a neurology for an off-legs dog, you tend to find that there is another department within referrals, such as boards, such as physiotherapists who have a special interest and obviously much more well equipped to deal with the day-to-day kind of physiotherapy of patients that may come through a referral hospital. So the key differences to remember between a general practice and referral practice are caseload. In a general practice, you're managing a range of patients, such as cats, dogs. You might see guinea pigs, your exotics, such as snakes, rabbits, even parrots, for their wellness exams and emergencies. So you will always be the first point of contact for a lot of clients. Within a referral practice, many of the cases may be more complex and they may also be more critical. So, for example, out of hours, general practices do offer out of hours, but they may be off-site, or it may be they don't offer out of hours. In that case, you may come to us or another referral practice for round-the-clock care. Specialisation, so specialised nursing care for more complex needs, due to more complex disorders, you will tend to see a higher number of patients, and you will tend to have a much better access to more diagnostic tools. And then you would definitely have multidisciplinary collaboration. Within referral, there's an element of working in closer collaboration with specialists. That's not to say that you don't work in close collaboration with general practice veterinarians. It just means that you may work alongside for instance, you might work alongside medicine specialists who are very focused, obviously, on the medical side of things and managing that side. Or, for example, you may work with surgeons or neurologists on that kind of side. And a lot of time, for every patient, it's not just one department that gets involved. So again, for example, a dog off its back legs, you'll have the neurology department, you'll have the physiotherapist / pain management. You'll have, obviously, the anaesthetist, the imagers, all kind of working through to get the best result for that patient. That concludes part 1. Please join us in part 2, where we will continue to discuss things such as developing your skills for a referral environment. Don't forget to like and subscribe to receive notifications about more videos from Langford Academy.